You know, if you're a parent, it's got to be one of the scariest sounds in the world. Hearing your child struggling for breath in the middle of the night. So in this explainer, we're going to break down that frightening cough, help you figure out what it could mean, and most importantly, how to spot a real emergency.
So, picture this. It's 2 in the morning, dead quiet, and suddenly you're jolted awake by this weird, harsh cough coming from your kid's room. It's a sound that just sends a chill right down your spine, and your mind just starts racing, right? What is that? What's going on? It is a moment of pure panic that, believe me, so many parents and caregivers have been through.
Okay, to really get what's happening with these coughs, we got to do a super quick anatomy lesson. We're zeroing in on this really small but absolutely crucial space. You've got the epiglottis, think of it like a little trapdoor over the windpipe, then the vocal cords right below it, and the trachea, which is the windpipe itself. Now here's the key. In kids, this whole area is way, way narrower than in an adult. And that is exactly why a little bit of swelling here can get so dangerous so fast.
All right, let's dive into our first and, by far, most common reason for that scary-sounding cough. We're talking about croup. And trust me, if you've heard this sound once, you will never, ever forget it.
This is a quote straight from a parent, and honestly, it's the absolute best description there is. This isn't your normal chesty cough, and it's not a dry little tickle. No, this is a loud, harsh, barking sound.
So why does it sound like a seal? What's actually happening in there? Well, it's fascinating, really. See, in croup, the part of the airway just below the vocal cords gets all swollen and inflamed. So when your child coughs, air gets forced through that super narrowed little passage, and it makes the vocal cords vibrate in this really weird way that creates that unmistakable, loud barking noise.
So what is croup officially? Well, it's a viral infection. Most of the time, it's caused by something called the parent influenza virus, and it usually hits kids between about 3 months and 5 years old. The main thing to remember is where the swelling is, right below the vocal cords.
Now, when doctors are trying to figure out if it's really croup, they have this classic visual they look for on an x-ray. Now, they don't always need to do one, but when they do, they're looking for what they call the steeple sign. And this picture gives you a pretty good hint why.
And there it is. See that? On an x-ray of the neck, that swelling causes the airway to get super narrow and taper to a point. It looks just like a church steeple. That is the textbook steeple sign of croup.
Okay, so what should you be watching for at home? Well, it usually starts out looking just like a normal cold. Runny nose, maybe a little fever, but then that barking cough shows up. Their voice gets all hoarse, and sometimes you'll hear this high-pitched whistling sound when they breathe in. That's called stridor. And for some reason, it always seems to get worse at night. But, and this is super important, notice what's usually not there. Kids with croup typically aren't drooling, and they don't look toxic. That's a word doctors use for a kid who just looks incredibly dangerously sick. Remember those two things.
Okay, we need to switch gears now and talk about something completely different. And I need you to really listen because this one is incredibly serious. This is epiglottitis, and it is a true life-or-death medical emergency.
Please pay close attention to this posture. This is one of the biggest, most critical warning signs you can see. The child will be sitting bolt upright, leaning forward, with their chin jutted out. It's called the tripod or sniffing position. They aren't just uncomfortable, they are instinctively doing this, using every muscle they have to try and pull their swollen epiglottis forward to open up their airway just enough to get a breath in.
Now, unlike croup, which is viral, epiglottitis is a nasty bacterial infection. What happens is the epiglottis, that little flap we talked about, it swells up so big, so fast, that it can literally block off the airway completely. It can be fatal if it's not treated immediately.
To help you remember the signs, just think of the 4 Ds. First, dyspnea. That's just a medical term for obvious difficulty breathing. Second, dysphagia. They have difficulty swallowing. It hurts way too much. Third, dysphonia. Their voice is muffled and quiet because everything is so swollen. And last, drooling, because they can't even swallow their own spit.
Okay, let's put these two side by side. Seeing them head-to-head like this is the absolute best way to make the differences crystal clear. And believe me, knowing these distinctions is just so important.
So let's run through this. Look at the onset. Croup kind of sneaks up over a few days like a cold. Epiglottitis hits like a freight train within hours. The cough is a massive clue. Loud and barking with croup, but with epiglottitis, it's often muffled or even absent because the kid is just too sick. And look at their appearance. With croup, a child is obviously unwell, but with epiglottitis, they look toxic,
just dangerously ill, and they're probably in that tripod position and drooling. Those are the huge red flags that you just don't see with Croup.
And if you need one picture to lock it all in your mind, this is it. The X-rays tell the whole story. On the right, you've got that pointy steeple sign from Croup showing the narrowing below the vocal cords. But on the left, look at that. In epiglottitis, you get the thumb sign. That huge swollen epiglottis looks just like a thumb sticking out, ready to completely block everything. It's a dramatic difference.
Now, not all of these sudden scary breathing problems are from an infection. Sometimes the cause is, well, a lot more straightforward.
Yep, we're talking about when a child breathes in something they shouldn't. It's called foreign body aspiration. An object gets stuck, and all of a sudden, you have a child who is choking, coughing, and wheezing out of nowhere.
And as you can see from this pretty shocking X-ray, kids can get their hands on just about anything. An object like this screw can get stuck in those tiny passages in an instant, creating a life-threatening blockage right away.
Coins are another really common one. So the bottom line here is simple. Any sudden, totally unexplained episode of choking, coughing, or wheezing in a young child needs to be checked out by a doctor, period.
Now, while we're on the topic of common childhood illnesses, let's touch on another one. It doesn't cause that same scary cough, but it's all connected to the same system. I'm talking about the dreaded ear infection.
Have you ever wondered why little kids get so many more ear infections than adults do? Well, it really just comes down to their anatomy. It's like a plumbing problem. See, there's a tube, the eustachian tube, that connects the middle ear to the back of the throat. In kids, that tube is shorter and a lot more horizontal. This design makes it way too easy for fluid and germs from a cold to travel up into the ear, get trapped, and boom, you've got an ear infection.
And it turns out there are a few things that can make them more likely. Age is the big one. They're most common in the first couple years of life. But other things, like being around tobacco smoke, having certain medical conditions, or even just going to daycare can all increase a child's risk. So, when you step back and look at the big picture, what's the real takeaway? A child's airway is just this marvel of biological design, but its tiny size is also its biggest weakness. It's just wild, isn't it? To think that a few millimeters of swelling can be the difference between a rough night with a barking cough and a true, life-threatening emergency. Thanks so much for joining us.